Welcome to The Pursuit of Health, the podcast of Americans for Free Choice of Medicine. I'm your host, Reinier Schuur. Joining us on the show today is Dr. Amesh Adalja. Dr. Adalja is a practicing infectious disease, critical care, and emergency medicine doctor, and he's also an expert in pandemic preparedness and public health. Welcome to the show.
Thanks for having me.
So, we're having you on today, Amesh, to talk about the distinction between public and private health. But before we do that, I think it is helpful for our audience to take a step back and ask ourselves, why is that distinction relevant for advocating for free markets in medicine? Now, what exactly is a free market in medicine? It is a market where people are free to voluntarily trade with each other, free from force, free from government. And it is also a free market because there's a recognition that your health is your own. It's private. It is not an asset of the group. But this automatically raises all sorts of legitimate questions, such as, does that mean that there's no role for governments in healthcare? What about pandemics? And how do you distinguish between the government being involved in preventing a pandemic and fighting the obesity crisis? Now, these are not simply theoretical questions. A lot of these questions were very much real and live issues in the aftermath of the COVID-19 pandemic. And in fact, the COVID-19 pandemic led not only to a growing skepticism of the role of government in healthcare in the form of public health, but also a wider skepticism of medical establishment and medical expertise overall. It is therefore a relevant question to ask if we are advocating for free markets in medicine. Where do we stand on the role of government in public health? And where should we draw the line between public and private health? And with that, Amish, let's start with just a very basic question. What is public health?
So I think there's not really one consensus definition on public health, but what I would think about is that there is this idea that certain diseases infect individuals and individuals make up populations. And there are many interventions that can occur in addition to an individual impact an individual, impact a population to overall diminish the rate of that health concern. So that sounds like a lot, but what it means is that there's certain interventions that are better suited to a population. So for example, from the infectious disease world, if you have a town that is lots of people get cholera in it, you can treat the individual cases of cholera, give them antibiotics, vaccinate them, give them rehydration therapy, or you can sanitize the water for the town itself. So one would be considered an individual health intervention, treating the individual patients. The other would be a public health intervention because you are basically dealing with the group of citizens as a whole to diminish the risk of that disease. So it has this distinction in terms of what the level of focus is. Is it the people in their communities or is it the individual? And many definitions they'll talk about, protecting and improving the health of the people and their communities is how they'll talk about public health. And it really integrates with other concepts like preventive medicine and population health, looking at the outcome of health outcomes of a group of individuals versus each individual themselves. So that's where it sort of comes from. And it's morphed a lot from its original beginnings to what it now is understood, or the working definition of it now. But in general, it's dealing with the health of populations.
So that strikes me as a quite broad conceptions under which you could have more specific stances on where to draw the line between what should and should not be public health. So could you tell me a little bit more, Amish, about where different conceptions of the role of public health come from, especially in terms of its history?
Well, the first public health departments that occurred or that were created happened during the Black Death in the Middle Ages in 1300, where small towns were worried about travelers bringing plague into their town. So they would have people show up at their town at some kind of checkpoint where they might be medically examined or put into a period of quarantine to make sure that they were not carrying plague into a town. So plague is a bacterial infection that is spread via fleas and transmits, and also can be transmitted person to person as well. So this was a contagious infectious disease that really started people thinking about public health and the control of communicable disease through population-based measures. Because what they were doing is saying, we're going to try and protect this population in this town by making sure no one comes in with a certain communicable disease. I mean, and you can even go back farther into, ancient Rome, where there are aqueducts and sanitation going on. Those can kind of also be seen as public health or sanitation projects that were in the end decreasing disease incidence. But I would really trace it, modern public health or the conception of government public health departments to the Black Death.
And so the focus there is on communicable diseases, but there also seems to be a view of public health as involved in sanitation, and then broader conceptions, even in like thinking of loneliness as a public health crisis, and really like expansive notions of public health where really anything it could fall within the scope of public health, including shootings, for example.
Yeah, so now it can be considered anything that adversely affects the adversely impacts the health of a community could fall under public health. And that's probably if you went into a school of public health and asked the average public health graduate student to define public health, they would say anything that adversely impacts the health of a community and the individuals within it, for which there can be interventions done as a whole to the community, like sanitation, like fluoridation, like uh, like gun laws, like seatbelts in cars, airbags in cars. All of those things are public health interventions in the modern sense, and they all morph from that original, Black Death type of intervention.
Now, before asking you what you think the proper scope of public health is, on this broader conception of public health where practically anything could fall under it, how do you think that affects not only the way that we think about health, but that the wider public thinks about the role of government in these kinds of issues and what that leads to?
So I think what's happened is that you've got a legitimate issue that, a healthy, all things being equal, a community with lower rates of disease, including non-communicable, including accidents, including homicide by gun, they're going to be more conducive to human flourishing for everybody. So you want to live in communities that are healthy, that have lower rates of disease. And that's a legitimate thing to be interested in. Where I think the problem occurs is when that becomes a government, then that gets outsourced or delegated to governments to put in place interventions where it's often one size fits all. Often it will involve government force, will often involve taxations and regulations that end up basically creating, a bigger footprint for government in this than what initially they should be restricted to. And I think that also comes down to, what people believe is a proper role for government. Some people obviously believe that all of these interventions are roles for government. For example, seatbelts, requiring seatbelts in cars, things like that. And other people don't. So it all kind of redounds on how a person thinks about the government and the role of the state in the role of in how individuals live their lives. And I think that there are clear lines where it absolutely is the government's purview to be involved in it, specifically when it comes to communicable disease, and other areas where it's not necessary. It's not a government role, even though in many municipalities in the United States now it is a government role, and that would be something that would be very disruptive if they weren't involved in it. For example, fluoride and fluoridation of the water in Utah until we had a better system. But I think it all comes down to that there is a legitimate value here in living in healthy communities, and many people think that the only way to do that, the only method to achieve that, is through government intervention.
And another thing that I think is interesting is that if you view certain conditions under a public health lens in order to justify government intervention or an expanded government role in general, it can also change the way that you think about certain conditions. It means that you will view them through the lens of public health as opposed to other lenses which might be more conducive. And in that way, it could actually change the way we think about certain conditions. I mean, one condition that I'm thinking of right now, which I've done research on in the past, is addiction, where very often the argument was made that if we can think of addiction as a disease that affects the wider public, then we can justify all sorts of resources to be dedicated to it. But that also changes the way that we think about addiction and like what the best way to think about certain conditions are. And in that way, the expanded scope of public health even affects the way that we think about health.
Yeah, I think that when you kind of abstract away from the individual suffering from the condition to the population, you lose something. That's what abstraction does. And that's going to change your perspective on it. And it may be that some interventions are better when they're done on a community-wide level in terms of getting the effect, the outcome. But I think you have to always continually tie it back to the individuals with the disease. And I think it becomes very difficult when you have government insurance company programs like Medicare and Medicaid, where everybody is tied together. So if you're paying Medicare taxes and you're having to pay for people's decisions to smoke cigarettes and then develop lung cancer or cardiovascular disease, obviously they're going to say, well, we need a public health intervention to stop this from happening because we can't afford it. Or if you're paying for, that catastrophic highway fund when people die in car accidents, then you're going to say, well, we're all tied together into this system and we're getting these taxes because of this. We're going to require motorcycle riders to wear helmets because we don't want to pay for their traumatic brain injuries. But so when you tie people together like that, it does change the way you even look at the interventions, and I think it does, kind of create a little bit of a war against all. If you see this obese person sitting next to you somewhere, you think that person's going to go on to Medicare eventually, and they're going to have higher healthcare costs that are going to make it harder for everybody else that's on Medicare.
So today there's a lot of distrust and skepticism of the medical establishment. And some people might think that, well, the way that we gain trust back with the public is simply to do a better job at public health, at the current scope that it is, but just trying to do it better, better literacy, better reaching out to people, better explaining why they do what they do. What do you think about that? What do you think about the current scope of public health and trust in the medical establishment? Is it just that they have to do things better, or is it the scope itself that's at issue?
Well, I think it's not necessarily the scope, but it's the way that it's done. So I think that there are important, so there could be not-for-profits doing things that to, get people to stop smoking cigarettes or to teach people about better, driving safety or whatever it may be. But when it becomes the role of government, it's going to necessarily involve force and regulations, and there's going to be people that don't want that to be the way that it's done, and that creates animosity between them, but between public health practitioners because they're working, hand in glove with government agencies and the individual person who might be feeling throttled by some things that are going on and feeling like it's a one size fits all thing. It's a government social control or a social experiment. And I think that COVID-19 really made that alive that made it really a live thing in people's minds because it wasn't something that they had dealt with probably for 100 years in the United States where we had those types of interventions being done with a whole of government response to control COVID-19. And that the way that that was handled with certain measures that were completely justified, some that were completely not, that was put on the heads of public health practitioners, often from government agencies, and that created so much animosity that now there is zero trust between the general population and public health is seen as a political end or even the legit what I would consider the most important parts of public health, the communicable disease control, that's seen as part of like a social experiment and it's part of your political identity, whether or not you think it's something that makes sense or something that doesn't make sense. And I think that's kind of the long tail of COVID, that anything in that field now is really going to be very difficult and fraught because you've got one tribe that is all in on it and one tribe that is completely against it all. And they've created a false alternative and not a way to actually think about what are the legitimate roles of government when it comes to the health of the citizens, and where do you draw that line and how do you draw that line? Because the people that are anti some of the measures from COVID or anti the COVID vaccine are at the same time supporting RFK Jr.'s efforts against ultra processed food or red dye or whatever it may be, which itself is an intervention into health in under the guise of public health. So I think what happens is you don't have anybody that legitimately wants to drill into what public health is. You have some people who look at it very expansively and some people who basically just pick and choose it politically, and it's politically expedient to go after the ultra processed food manufacturers, but not so for other aspects of it. So it's not, I think it's all muddled in people's minds, and that distrust is only going to increase.
And I think the fact that it's muddled points to the need to have clearer thinking in this area. And I think that what you pointed out about, well, it's not exactly the scope, it's how you do it, and that a lot of what the government currently does under the guise of public health are legitimate values, but might be better done by charities, or there might even be a role for insurance there in a more deregulated system where they have a profit motive to prevent people from getting sicker, for example. But so if there's this need for clearer conceptualization of the role of government in public health, what should that scope actually look like?
So I think if you're thinking about what governments are constituted for, it's to protect individual rights. Where do individual rights get involved when it comes to health conditions? And that really drills into communicable diseases, where one person infects another person. And that's a rights violation. You don't have the right to infect somebody else, even if you do it unwillingly, even if you do it unwittingly, you don't know. That's where you're, indirectly or directly exerting force on somebody else, where you have one, you basically think of an infectious organism as a missile going from you to somebody else. That's where governments need to have a role to deal with thinking about isolation, quarantine, and that's initially how public health really started during the Black Death. It was really about that focus. They weren't focused on, tetanus, which is an infectious disease but non-communicable. They were focused on plague. They were focused on cholera. They were focused on smallpox. Those are all communicable diseases. And that's where I think you have to think about that as the core function of public health in a legitimate situation. And now you have a situation where more money is spent on non-communicable disease than communicable disease, and we are unable to actually do what we need to do in communicable disease. So, for example, in the local health department here in Pittsburgh, a lot of money may be spent on dealing with U.S. steel and pollution, much more than is spent on, gonorrhea, which is a communicable disease, because one is flashy and sexy and gets headlines, and politicians are responsive to, but a politician doesn't care about a sexually transmitted infection, even if people are spreading it from person to person. So you have very few resources to actually do the core functions of public health, and they're all being pulled to other parts. And then you end up with a very inefficient system. And when something happens, like a public health emergency, like COVID was, you don't have the personnel to do it because that part of it, public health, is considered, not very valuable. It's not, when's the last time you saw a mayor run on their infectious disease control in a town that said we have the least cases of congenital syphilis? They've never done that, or the least cases of tuberculosis. They don't care about that. They don't even know what it is. So it's not. So what I think has happened is that expansive definition has made it very hard for people to do the actual core parts of public health, and I think that has made us much less prepared for things that we really need, where government can only be the actor, which is during a pandemic or a bioterrorism attack or whatever it might be, where there's a communicable disease or some force being exerted. That's how I think about where it is. And of course, that you have to keep in mind that in the context of today in 2025, the government does a lot of stuff, and I'm not advocating that they stop doing it tomorrow, because this is how our system works, and there needs to be a transition and real thinking about how to do this and how to devolve some of these things because. Right now, people's lives depend on some of those programs that are in place, and I think that you don't want to be in a situation where you create more chaos, like what Doge was doing by just shutting off programs where people were half done with their tuberculosis regimen and in some part of the world or HIV regimens, just cutting it off. That's unnecessarily cruel and not an organized manner or a rational way to do it.
So you've raised a lot of interesting points that I would like to touch on, but just to go back to your initial point on the fact that the proper scope of public health should be communicable diseases. What exactly is the difference between, for example, someone coughing on me versus, I don't know, my neighbor being obese or having cancer? It seems like a clear distinction, but someone might think that people in my community being ill affects me, right? It affects the wider community. I'm less well off living around sick people, even if they can't make me sick. I might have to pay for their healthcare indirectly anyway. I mean, you see campaigns for getting rid of cigarettes in places like New Zealand. So, what exactly is the distinction between those kinds of conditions?
One directly impacts you, whereas others are are not impacting your life in any sense. They're not penetrating your body. They're not violating your rights. These are things that this is a society that you live in that you have that they're going to be that you're kind of tied in that community and the society. And obviously the health of everybody else, the more healthy they are, the better it redounds on you. Just like the more wealthy they are, the better it redounds on you because you live in a more flourishing environment. But that's not the same thing as your rights being violated by somebody being obese or somebody uh, vaping or whatever it may be. If it's not directly impinging on uh, your ability to live your life, then it's not a real role for government. So somebody being obese is a bad thing, something that needs to be taken care of, but it's not a role for government to be involved. But the thing is that we in the United States, we have all of these, then it gets really muddled because it's almost say, well, why are you subsidizing corn farmers and have sugar tariffs and all of these things that make people unhealthy? But that's a separate issue, but because we live in this mixed economy. But in general, if someone's disease cannot communicate from them to you, then that's not a role that's not a communicable disease and therefore not something that I think has where government has a role. Although there are other organizations like insurance companies that do have a role and in trying to address these issues at a population level.
Right. So, just to be really clear, when, let's say, for example, the government intervenes in me making my neighbor sick because I've Ebola, for example, that's not necessarily the government wanting to keep the public healthy in the sense that there's such thing as the health of the public at large. They're protecting my neighbor from me.
Right. It's down to the individual level. And then you can even say that if someone is walking around in a shopping mall with tuberculosis, they're trying to keep the individual shoppers safe by isolating that patient.
And how
Because
then,
sometimes it's not just this neighbor and that neighbor. Sometimes it's there is an active case of typhoid fever in your town. We need to find it because that's causing problems of people getting sick, even though they don't know an individual. That person presents a clear and present danger to others.
and how then do we distinguish between what is worth intervening in and what's not? Because surely you're not suggesting that the government intervene if I have the flu, which I could spread to others.
No, there has to be some demarcation, and this is something very hard to really delineate. What is of high consequence and what is of low consequence, and that may change in different contexts depending upon the state of immunity of the population, the risk tolerance of the population, what interventions are available for the population in terms of vaccines, antivirals, all antibiotics, all of that plays a role, and that may change. So something might be more tolerable in 2025 than it would have been in 1925, and vice versa. Something that was tolerable in 1925 may not be tolerable in 2025.
How would you respond to someone, though, that might argue that giving the government this kind of power to intervene in our lives, even if it might be on some legitimate grounds, gives them too much power, and it's better to err on the side of not giving them this power at all, lest they abuse it?
Well, I think that's the case with any type of government intervention. It has to come down to, that you have legitimate, you're a government of laws, and you have laws that the government follows. And I think that you have to recognize that it's much, suppose what we don't want are people taking the law into their own hands, and they think somebody has Ebola. Maybe they don't, and they do something horrible to that person. You don't, just like you don't want vigilantism when it comes to infectious disease.
Now, given all of this, Amish, how do you think that this perspective on the distinction between private and public health, how should that inform our view of responding to, let's say, RFK Jr. and the Maha movement, right? Because in many ways, they are a response to certain failures of the COVID-19 pandemic. And in some ways, maybe even they would argue an expanded scope of public health. So they could maybe argue, hey, we're on your side.
Well, I think when I'm trying to address some of the things coming out of the Maha and RFK Jr. camp, it doesn't even get to the level of public health, because there's basic scientific issues that need to be actually articulated before you can even get to thinking about public health. Because if someone doesn't believe in the scientific method or the germ theory of disease, or denies the efficacy of vaccination, you can't, you don't even get to the point of what should government's role be, because then you're not even agreeing on a basic reality or a basic framework, the basic framework that governs not just public health, but health in general. When you think that drinking raw milk is safe and fine, you can't really even think about, should government be providing milk to kids. So I don't even think that, I don't know what RFK Jr. is somebody that does believe in heavy government intervention. We've seen it already. He's not somebody that has any narrow view of public health. He just has a skewed view of public health, one that's completely unmoored from science and medicine. I would say that the standard public health that's taught in public health schools, the ones that the average, county or city health department does, that's, even if you might disagree with what they're doing, it's rooted in science and medicine, and it's based on that foundation. What RFK Jr.'s is completely unmoored from that foundation. So it's disastrous. Whatever issues you have with standard public health, it's even worse because with RFK, because there's not even any kind of scientific grounding for it, as you've seen with his support for unpasteurized milk or fluoridation of drinking water. All of those things are completely unmoored from scientific data or anything with coming near vaccines.
Yeah, one thing that I find fascinating about the Maha movement and RFK in particular is that on the one hand, they'll claim to be for medical freedom, and which includes strange things like drinking raw milk and all these other things. But then on the other hand, you'll have him and the people that he influences, like Dr. Ah, saying you have a patriotic duty to be healthy. So there's this view that we're going to make America healthy again as a collective, where again the perspective is that it is the public health that we want to have expanded. We just want to do it in our own way, in a way that is different from the current establishment, but they still want their own establishment.
Right. It's just, I don't think I would think of that as anything but a nefarious, nihilistic, irrational movement that is against anything human. So he is against anything that is not natural, is basically how I would think of it. That this is a strain that runs from him as an environmental activist, an environmental lawyer, to now. That this is him getting healthy is basically removing any kind of human ingenuity from it. As I said, he doesn't believe in germ theory of disease, so he does not believe in the value of vaccines. Uh, and he doesn't, everything that he even when he goes after food additives and pesticides and all of that, it's because they're man-made, that they're coming from human ingenuity. And anything that alters the environment in that way, including the human body, he thinks is unnatural and not how you become healthy. Hence, pasteurizing milk makes it not valuable to him.
So where exactly did we go wrong? I mean, you mentioned that um, public health initially was much more concerned with communicable diseases. Why did it expand beyond that scope?
I think because people were trying to achieve other aims through public health. They wanted healthy, they wanted people to flourish, they wanted to deal with societal scourges, and they used that the using public health was one means to do it. So they were trying to achieve other societal gains or aims through the lens of health. There's this concept of social determinants of health, and if you think about that, how a person lives, their income, all of that kind of stuff does have an impact on health, but it also is part of kind of social engineering and how governments or social activists want to recreate society. And health is an easy way to do it because it gives you a lot of legitimacy. It gives you science and medicine and it integrates with what people know to be healthy in general that or know it somewhat integrates with how humans flourish. So it's an easier way to do it than to just create a program. If you can actually provide, or if you're talking about the fact that this has some kind of health benefit that will eventually trickle down to individuals, that's an easier thing to sell. Or if you say science is on my side and medicine is on my side, that's an easier way to achieve whatever goal that might be. And and I think that it's not all bad because if you think about reproductive rights and the way birth control and abortion rights happen, that's how it came. Through a lot of social activists thinking about it as a public health problem helped codify it as law in many parts of the world. And so you have to, it was a tactic, I think, and I think and now it's kind of become very, very big, but it's a tactic that worked. And that's why it continues to be moved from communicable disease to non-communicable disease to societal problems like gun violence and and uh and reproductive rights and whatever it may be, because it works. It was one way to get it was much more palatable to the general population, I think.
So it seems that when it comes to the current scope of public health, part of the problem is that it is not purely nefarious, right? There are legitimate values that people want to achieve. It's just the way that they want to achieve it is through this guise where it introduces both this idea of the health of the public as opposed to individuals, and then some justification for a program, which means force. So how do we separate those two? And what is the role for philosophy here in clarifying our own thinking of how we can advocate for a smaller scope of public health, communicable diseases, to bring it back to that scope while still advocating for these other legitimate values?
I think first we have to get, I think philosophy has a role in defining the proper role of government and what is properly in the purview of government, what isn't. And then I also think philosophy has a role in talking about, what's conducive to a rational human life and what isn't. And I think, and that doesn't necessarily mean that what's conducive to a flourishing life is a role for government to create or to make or to force people into that situation. You kind of have those two things and you have to figure out how to integrate them. And I think that communicable diseases are the link. And I think maybe thinking about severing communicable diseases from the rest of public health and to think about how to kind of create, at least two pillars right now. So you have one that you understand as the legitimate functions or the core functions, and others as kind of superfluous. And you start to move that away from the government, and maybe in a more free enterprise system, you would see insurance companies themselves taking on some of those roles and creating programs because it's in their financial self-interest to be able to have a healthier population that they're insuring. And I think that's how philosophy has to kind of go back. It has to go back to the core principles and also make the case for the legitimate functions of government when it comes to these population health or infectious disease types of threats. And then I think but it is a hard battle because I think it is something that the government has really crowded out. So we don't know, we don't have the counterpositive of how this would have occurred without, because it was seen as such a government intervention. Even if, as I said, going back to like the sanitation projects in the Roman Empire, that was all seen as something that the governments were doing. So it does take a lot of thinking back to first principles.
To the extent that bringing the scope of public health back to communicable diseases and having the free market play a larger role in those other areas, to what extent do you think that requires rethinking the notion that there's such thing as the health of the public versus individual health?
Well, I think you have to recognize that the public is the individual. So there can be a healthy community and an unhealthy community. That those are real things, but it all drills down to the actual individual health of the members of that community. There's no such thing as a community apart from the members of that community. And each person might value health differently based on their own individual circumstances. That, it's only specific people that exist. And you have to really think about what the intervention is meant to do. The intervention is meant to improve individual people's health. And yes, you can abstract that away to a community, but not everybody's going to have those same values. And somebody might be okay being obese, even though it's bad for them, and and will lead to other bad health outcomes. But that's how they value health in their own hierarchy of values. Each person's going to be different, and you can't kind of dictate that from you shouldn't be dictating that from on high. And that's why when it comes to communicable disease, because it directly impacts another person, you actually have a legitimate case there.
Yeah, I think that's very interesting. And I think that that also offers a useful contrast to the Maha movement. The way that I see it is that on the one hand, you have people in that movement who want to take responsibility for their own health. But on the other hand, they regard the medical establishment as being corrupt, and uh, there's an inherent distrust of dealing with experts. But from my perspective, I'm not a medical expert. I have a background in philosophy. In order for me to be healthy, I need to be able to trade with experts. And I think part of the problem is that people feel that either our relationship with experts is that we need to be dictated to, or it's a kind of free for all kind of anarchy of medical science, is that I do my own research and whatnot. Of course, doing your own research has a role, but it's what does that actually mean? Does it mean that, well, my research is just as good as a doctor's? And from my perspective, if we want to actually take responsibility for our own health, it means being free to trade with medical experts. And I think that having a clearer distinction between the scope of public health versus private health would certainly help with that.
Yeah, I think there's definitely there's a false alternative between paternalism and then going your own way. And I think that's something that needs to be addressed, that there is a lot of paternalistic sentiment in public health amongst people in the field, that people don't know what's good for them and they talk down to people. They give them one size fits all messages. There's no nuance, and they don't trust people with their own decisions. And I think that definitely is a major streak, which some of it got exemplified during COVID, that has to be addressed, because I think what it ends up doing is driving people into the other side of that false alternative, and then you have distrust, and you have the go at your own way, use Reiki, drink unpasteurized milk, do all of that.
And to the extent that other groups that claim to advocate for free markets in medicine either exhibit hostility or skepticism to perhaps either the very notion of public health, or they're confused about where to draw the line. What would you tell them?
Well, I think that when we're talking about freedom in medicine, what we're talking about is a freedom to contract between patients and doctors and other parties that might be involved. We're talking about free enterprise. We're not talking about freeing yourself from the constraints of reason or logic or science or the scientific method. What a free enterprise in medicine will do is actually unleash the scientific method in a way that we probably have never really ever experienced, where innovation and legitimate improvements in health would occur on a much more frequent basis, with major breakthroughs occurring not only in diseases that we haven't conquered, but even in diseases that we deal with all the time, or innovative care models to allow people to attain the health that they want to attain. But the only way that that's done is on a basis of Western medicine and reason and science and logic. And if you can't really think that if you have free enterprise, but only free enterprise to do non-Western, non-evidence-based medicine, that's I don't really think that's what they're actually advocating for, and I don't think that's a better situation than what we then that's not a better situation. That's actually a worse situation because the foundation of medicine has to be the Enlightenment values.
Well, thank you, Amish, for coming on to the show. Would you like to tell our audience where they can follow your other work?
You could find me on Twitter and Blue Sky. It's just at AMESHAA.
Well, thanks again for coming on, and till next time.
Thanks for having me.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.